Namaste. I am Dr. Shaima Kadri from Faculty of Physiotherapy and Diagnostics, and today in this video we are going to talk about stress fracture. So let's begin with it. A stress fracture is a small crack in a bone, a severe bruising within a bone. Most stress fractures are caused by overuse and repetitive activities and are common in injuries and athletes who participate in running sports such as soccer and basketball. Stress fractures usually occur when people change their activity, such as by trying a new exercise, suddenly increase in the intensity of their workout, or changing the workout surface, jogging on a treadmill versus jogging outdoors. In addition, if osteoporosis or other disease has weakened the bone, just doing everyday activities may result in a stress fracture. The weight-bearing bones of the foot and lower leg are especially vulnerable to stress fractures because of the repetitive forces they must absorb during activities like walking, running, and jumping. Referring from high impact activities for an adequate period of time is key to recovering from a stress fracture in the foot or ankle. Returning to activity too quickly can not only delay the healing process but also increase the risk for a complete fracture. Should a complete fracture occur, if it will take far longer to recover and return to activity. As we talk further about the stress fracture, the features occur most often in the second and third metatarsal in the foot, which are thinner and often longer than the adjacent first metatarsal. This is area of greater impact of the foot as patient put off when patient walk. Stress fractures are also common in the calcaneus, fibula, and talus, and the navicular also, which is the bone of top on the midfoot. Many stress fractures are overuse injury. They occur over time when repetitive force result in microscopic damage of the bone. The repetitive force that cause a stress fracture is not great enough to cause an acute fracture, such as a broken ankle caused by a fall. Overuse stress fracture occur when an athlete movement is repeated so often. Weight-bearing bones or supporting muscles do not have enough time to heal between exercise seasons. Bone is in the constant state of the turnover, a process called remodeling. New bone develops the replace older bone if an athlete activity is too great. The breakdown of older bone occurs rapidly. It outpaces the body's stability to repair and replace it. As a result, the bone weakens and becomes vulnerable to stress fracture. The causes are the most common cause of stress fracture is a sudden increase in physical activity. This increase can be in the frequency of activity, such as exercising more days per week. It can also be in the duration or intensity of activity, such as running longer distances. Even for the non-athlete, a sudden increase in activity can cause a stress fracture. For example, if someone walks infrequently on a day-to-day basis, but end up walking excessively on the uneven surface while on a vacation, patient may experience a stress fracture. A new style of shoe can lessen the foot ability to absorb repetitive forces and result in stress fracture. Bone insufficiency. Conditions that decrease bone strength and density, such as osteoporosis and certain long-term medications, can make more likely to experience a stress fracture. Even when patients are performing everyday activities, for example, stress fracture are more common in the winter months when vitamin D is lower in the body. Studies show that female athletes are more prone to stress fracture than male athletes. This may be due to the part to decrease bone density from a condition that doctor called the female athlete thread. When a girl or a young woman goes to extreme in dieting or exercise, 3 inherited illness may develop: eating disorders, menstruation dysfunction, and premature osteoporosis. As a female athlete, bone mass decreases, her chances for getting a stress fracture increase. Poor conditioning. Doing too much too soon is a common cause to stress fracture. It is often the case with individuals who are just beginning an exercise program, but it occurs in experienced athletes as well. For example, runners who train less over the winter months may be anxious to pick right where they left off the end of the previous session. Instead of starting off slowly, they resume running at the previous mileage. The situation in which athletes not only increase activity level but push through any discomfort and do not give their bodies the opportunity to cover can lead to stress fracture. Improper technique, anything that at least the mechanics of how foot absorb impact as it strikes the ground may increase the risk of stress fracture. For example, if someone have blister, non-union, malunion, tendinitis, it may affect how patient put weight on the foot when they walk. And may require area of bone to handle more weight and pressure than usual. Change in surface. A change in training or playing surface, such as tennis player going from a grass court to a hard court, or a runner moving from a treadmill to an outdoor track, can increase the risk of stress fracture. Improper equipment. Wearing worn or flimsy shoes that have lost their shock absorbing ability may contribute to stress fracture. The symptoms are: the most common symptoms of the stress fracture is the foot or ankle pain. The pain usually develops gradually and worsens during weight-bearing activity. Other symptoms may include pain that diminishes during rest, pain that occurs as the intensifies during normal daily activity, swelling on the top of the foot or the outside of the ankle, tenderness to touch at the site of the fracture, possible bruising. The first stage is to see to the doctor as possible if patient thinks that you have a stress fracture. until the follow the RICE protocol, and the RICE protocol stands for field rest, compression, and elevation. Rest avoid activities, put weight on the foot. If patient have to bear weight for a reason, make sure patient are wearing very supportive shoe. A thick soled crocked sandal is better than a thin slipper. Ice and compression. After that, we talk about the examination. Here, the physical examination is done. Medical history and general health is discussed with the patient. He or she will ask for the work and other activities, like a normal assessment is done over with that. Then the imaging testing, where doctor is prescribed the X-ray. After that, the treatment is given. The goal of the treatment is relieving pain and allow the fracture to heal so that patient can able to return the activity following the treatment plan. Treatment will be very depending on the location of the stress of the fracture. After that, non-surgical treatment, in which the reduction is done after the surgical treatment, where screws are placed over the area. So this is all about stress fracture. If you have any queries related to this video, ask me in comment section. This video is powered by digital version of 2.0 Jyoti Vidyapeeth Women's University. Namaste. Khush rahiye.